When you attend the hospital to see your spinal surgery team, you may be coming to a paediatric hospital or a hospital where both children and adults are seen. This is Bristol Royal Hospital for Children, which was the first purpose-built children's hospital in the southwest of England. All of our hospitals will have a main reception area upon arrival. This may include food and drink amenities. The first place you will meet the spinal surgery team is in your spinal surgery clinic appointment. Above is a picture of the Rainforest Outpatient Department at Bristol Royal Hospital for Children. In your clinic appointment, you might meet several members of the spinal surgery team, including clinicians, nurses, and physiotherapists. If surgery is being planned, the outpatient department is often where you will discuss the details of your spinal surgery, and the team will be able to answer any questions you have about your admission and your post-operative journey. Children visiting the spinal surgery clinic may require x-rays to help the consultants look at the details of their spine. If surgery is needed, you will receive a date to come into hospital and be informed of what ward to attend on the day of your surgery. On admission, you will be greeted by the nursing team and be seen by several members of the team prior to surgery to do the final checks before heading off to theatres. Spinal surgery takes place in a specialist theatre. In most hospitals, your parent or guardian can go with you to the anaesthetic room, as we appreciate this can be quite an anxious time for both the patients and the parents. When the operation is complete, patients will move into a recovery area within the theatre department. The theatre team will call the ward that you've arrived to tell your parents or guardians that their child's operation has finished and ask them to come down to see them. Following spinal surgery, most children will require a stay in the high dependency unit or intensive care unit. The length of time needed on these units depends on many factors, including the length and complexity of surgery, as well as other medical conditions that can impact on recovery time. Once a patient is medically assessed to be well enough to not require high dependency care, they will be moved to a more general ward for the remainder of their hospital stay. Once a patient goes home, they will be asked to come back to hospital within the first few weeks of discharge to review their spinal surgery wounds and dressing. They will have the opportunity at this point to discuss any issues post-surgery with our specialist nurse. Within the first few months following discharge, your consultant will see you back in the outpatient department to check recovery is going well and to take further x-rays of your spine to ensure clinically things are okay. Throughout your time with us, you will be constantly supported by the nurses, doctors, and medical team.